Have you ever noticed your horse just isn't quite right? Maybe they're struggling with something like laminitis recurring, or perhaps they've just lost that usual spark, that oof, you know so well.
Yeah, it's surprising sometimes.
It really is. And it's surprising how often something as, well, seemingly simple as blood sugar can actually be right at the heart of these complex and frankly frustrating issues.
Absolutely.
Welcome to the deep dive. Today we're going beyond the surface to understand equine hyperglycemia, or put simply, high blood sugar in horses.
Hmm.
We've gathered a stack of specialist insights, really, to give you a clear, practical understanding of this vital health topic. Think of this as your shortcut to, being truly well-informed on what happens when your horse's glucose levels get out of balance.
And that's exactly where we need to start, really. Hyperglycemia.
Mm.
It's simply an abnormally high concentration of glucose sugar in the blood.
Okay.
Now, a horse's normal blood glucose usually sits somewhere between 60 to 110 milligrams per deciliter, or maybe 3.3 to 6.1 millimoles per liter. Slight variations depending on the lab, of course. Right. But it's crucial to remember that a quick, temporary spike isn't always a problem.
Okay, that's good to know.
But persistent or severe hyperglycemia, that is a significant red flag. It often signals an underlying metabolic dysfunction, maybe an endocrine disease, or even a serious systemic illness.
So to really get our heads around this, maybe let's just briefly unpack how glucose works in a horse's body.
Good idea.
Glucose is the primary fuel source,
Yeah.
right? Especially vital for the brain. Think of it as like premium gasoline for the horse.
Exactly.
Now, there are two main hormones that act kind of like traffic cops directing that fuel. First, there's insulin. You can imagine insulin as the usher for glucose, guiding it from the bloodstream into your horse's muscle and fat cells for energy.
Right, letting the glucose in.
Exactly. And it also signals the liver to slow down its own glucose production.
And then you have glucagon, which is insulin's counterpart, you could say.
Yeah.
It's produced by different cells of the pancreas. Glucagon is more like the emergency generator. It tells the liver to release more glucose into the blood. It ensures there's always enough fuel available, especially when energy demands suddenly go up.
Gotcha.
And beyond those two main ones, there are other counter-regulatory hormones, things like cortisol and the catecholamines.
Which are?
That's epinephrine and norepinephrine, basically adrenaline.
Ah, okay.
These all work against insulin, pushing blood glucose levels up.
So when we're talking about hyperglycemia, we're fundamentally looking at an imbalance then.
That's it.
It's either too much glucose being pumped into the system or not enough being used up by the body's cells.
Precisely. And as we'll explore, this often boils down to issues with insulin itself, or maybe an overabundance of those counter-regulatory hormones.
Okay, now let's dive into the different scenarios where you might actually see high blood sugar in a horse. Because like you said, it's not always a crisis.
No, definitely not.
Sometimes it's a perfectly normal temporary response. This is what we call physiological hyperglycemia.
That's right. And probably the most common example is postprandial hyperglycemia.
Postprandial, meaning after eating.
Exactly. A natural temporary rise after a meal, especially one that's higher in carbohydrates, sugars and starches. Your horse eats, glucose enters the bloodstream, levels go up for a bit. That's just the body doing its job.
Okay, makes sense. But what's truly surprising, I think, is that it's not just food that can spike blood sugar. Even acute stress or excitement or pain can temporarily raise those levels. Like, imagine your horse stressing about an upcoming farrier appointment.
Or a vet visit.
Yeah. Or during a bout of colic, their blood sugar might just be telling on them.
It really puts that fight-or-flight response into perspective, doesn't it?
It does.
The body releases those stress hormones we mentioned, catecholamines and cortisol.
Right.
These hormones signal the liver to produce more glucose, basically flooding the system with readily available energy. And they also make cells less responsive to insulin, temporarily. It's a very common response, usually mild to moderate and temporary. You see it a lot in hospitalized horses, or those experiencing acute, severe pain.
But what happens when that spike just doesn't come down, when it persists and it signals something deeper, an underlying issue?
Well, that's where we move into what we call pathological hyperglycemia.
Right.
And the biggest player here, really a chronic challenge for so many owners, is insulin dysregulation, or IDC, which is right at the very core of equine metabolic syndrome, or EMS.
EMS, yeah, we hear that term a lot.
We do. And what's truly insightful here is realizing those visible clues, things like a crusty neck or chronic laminitis, they aren't just cosmetic concerns.
No.
They're your horse's body literally signaling a metabolic struggle happening beneath the surface, a struggle with insulin.
So EMS, it's a collection of issues.
It's a constellation of abnormalities, yes. But at its heart is insulin resistance. Now imagine your horse's cells are like locked doors, and insulin is the key. With insulin resistance, those locks get kind of rusty, and the keys, the insulin, just don't work as well to open the door for glucose.
So if the keys aren't working properly, what happens to the blood sugar then? Does it just immediately shoot up?
Not always, and this is a really crucial distinction. In the early stages, the pancreas often tries to compensate. It frantically produces more keys, more insulin.
Ah, okay.
That's what we call hyperinsulinemia. It's trying desperately to get those doors open and keep blood sugar levels normal.
So it's like the body's working overtime?
Exactly. But if that insulin dysregulation progresses, or, if the horse is on a diet with way too many simple carbohydrates, eventually that compensatory insulin production just isn't enough.
And that's when you start seeing the high blood sugar.
That's when you see overt hyperglycemia. And this whole process is powerfully linked with obesity, especially those regional fat deposits, think the classic crusty necks, fat pads over the tailhead.
Great.
It's also strongly associated with recurrent laminitis and high triglycerides in the blood.
Are certain breeds more prone?
Yes, definitely. There's a genetic predisposition in certain breeds, ponies, Morgans, quarter horses, Arabians, some warm bloods too.
Interesting.
But beyond genetics, factors like obesity itself, lack of exercise, and those high heart or liver, non-structural carbohydrate NSE diets are all really significant risk factors.
Okay, so beyond EMS, another major contributor to this pathological, persistent high blood sugar comes from other endocrine disorders.
Huh?
And the one we probably hear about most often is pituitary pars intermedia dysfunction, or PPID. Most people know it as Cushing's disease.
Exactly, PPID.
Yeah.
Now, while it's distinct from EMS, they often coexist, which can really muddy the waters sometimes.
Oh, so?
Well, with PPID, changes in the pituitary gland lead to the body producing excess cortisol.
The stress hormone.
That's the one. And that excess cortisol then causes insulin resistance and it ramps up glucose output from the liver. So it's essentially creating a double whammy for blood sugar levels.
Ah, okay, that makes a lot of sense. So a horse with PPID, even if they aren't obviously overweight like an EMS horse might be, they might still develop insulin resistance because of that chronic flood of cortisol, making them susceptible to high blood sugar.
Precisely. It's a very common consequence of PPID.
So what are the classic signs of PPID that owners should be looking out for?
You'll often see that long curly hair coat that doesn't shed out properly. That's called hirsutism.
Right, the fuzzy look.
Exactly. Also, increased urination and thirst. We call that polyuria, polydipsia, or PUPD. Muscle wasting, maybe a pendulous or pot-bellied abdomen, and recurrent infections are also common.
And it's mostly older horses.
Predominantly, yes.
Yeah.
Typically horses over 15 years old. And it's worth just mentioning here, too, that if your vet administers corticosteroids therapeutically, like dexamethasone, you should expect to see a temporary rise in blood glucose. Those drugs mimic the effects of natural cortisol, so they cause a similar temporary insulin resistance. It's a known side effect.
Okay, good to know. Now, setting aside these chronic endocrine issues for a moment, high blood sugar can also be a really critical sign when a horse is severely ill, right? Like with systemic inflammatory response syndrome, or SARS, or sepsis.
Yes, absolutely. In severe illnesses, think severe acute colic, bad pneumonia, peritonitis, the body releases this storm of pro-inflammatory cytokines, plus catecholamines and cortisol.
The stress response again, but amplified.
Massively amplified.
Yeah.
This whole cascade causes widespread insulin resistance and ramps up glucose production as the body tries to cope with extreme stress. It's very common in critically ill foals and adults.
And does that high glucose level tell you anything about how serious it is?
It can, yes. What's particularly important here is that persistent or severe hyperglycemia in these sick horses can actually be a negative prognostic indicator. Meaning it suggests a poorer outcome. It reflects just how severe the stress and the metabolic derangement really are. It signals a struggle at a really deep metabolic level.
Okay. Before we move on to diagnosis, we should probably briefly touch on pancreatic disease. You hear about diabetes in humans and dogs all the time.
Right, but thankfully it's incredibly rare in horses. Not a common concern like EMS or PPID.
That's a relief.
It is. But it's worth noting that issues like true insulin-dependent diabetes mellitus, kind of like type 1 diabetes in humans, can, in very, very rare instances, lead to hyperglycemia. This would be due to the destruction of those insulin-producing cells in the pancreas.
Okay.
Other extremely rare causes could include things like pancreatitis or pancreatic tumors, but again, very uncommon in horses.
And finally, there's one more category, iatrogenic hyperglycemia, which sounds technical, but...
It just means human-caused.
Oh, okay.
This can happen sometimes from, say, excessive glucose supplementation, like over-administering IV fluids containing dextrose, particularly in little foals,
Right.
or maybe improperly formulated or excessively rapid infusions of parenteral nutrition, that's IV feeding. And even certain medications, beyond the corticosteroids we mentioned, can cause it. Some sedatives, like xylazine or ditamidine, can temporarily bump up glucose levels.
Okay, so we've covered a lot of ground on the why, the many reasons your horse might have high blood sugar. But how do you, as an owner, even begin to figure out if high blood sugar is the culprit? And then, what kind of high blood sugar are we dealing with?
A critical question.
Let's start with what you might actually see, the clinical signs.
Okay, so when hyperglycemia is really severe, you might see some noticeable direct signs. Things like polyuria, that's increased urination.
Why does that happen?
It's because the glucose level in the blood gets so high, it actually exceeds the kidney's ability to reabsorb it all. That threshold is typically around 180-200 mg/dL. So the excess glucose spills into the urine, taking water with it.
Oh, okay.
And that fluid loss then leads to polydipsia or increased thirst as the horse tries desperately to compensate.
Makes sense.
Lethargy or weakness can also be present. However, it's actually rare to see significant weight loss, despite an increased appetite in horses with chronic severe hyperglycemia, unlike in some other species.
Interesting. So more often you're probably looking for those signs related to the underlying cause, right?
Exactly. That's usually more common. So if it's EMS, you'll be looking for the obesity, especially that cresty neck or those fat pads over the tailhead, and crucially, a history of laminitis.
Right.
For PPID, the classic signs are that long, curly hair coat, the increased urination and thirst, PUPD, muscle wasting, maybe that pot belly, and recurrent infections.
Okay.
And if it's SIRS or sepsis, well, you'll see more general signs of severe illness, fever, depression, not eating, abnormal vital signs.
So many owners might first notice something like a subtle lameness or maybe that developing crusty neck, and they might never connect it immediately to something as internal as blood sugar.
That's very true.
It really is a real aha moment when you realize these external clues are pointing towards an internal metabolic puzzle.
It is. And that leads us directly to the diagnostic approach, which needs to be a systematic investigation by your veterinarian.
Right. And the very first step, often the most crucial, is getting the all-important history.
Absolutely vital. Your vet will ask a whole series of questions. What's your horse's diet like? Is it high in non-structural carbohydrates, NSC?
Grains, sweet feeds, lush pasture.
Exactly. Have there been any recent weight changes or signs of obesity? A history of laminitis is absolutely critical information. Any previous illnesses or major stressors like a severe colic episode or a bad infection. And of course, what about medications? Especially any history of corticosteroid use. And naturally, it'll ask about those classic PPID signs like the coat changes, the hirsutism.
Okay, so you gather all that information first, then comes the hands-on part.
Then comes the physical examination. The vet will assess your horse's body condition score, BCS, and look specifically for any regional fat deposits. A thorough lameness exam is vital to check for current or past laminitis, and they'll do a general assessment looking for any signs of systemic illness.
And then we get to the lab work, the science of diagnosis, laboratory diagnostics.
Right. Now, a single baseline blood glucose sample can show hyperglycemia, but you have to remember, stress alone can elevate it temporarily.
Like the stress of the vet visit itself.
Exactly. So a fasted glucose sample, usually after 8-12 hours overnight without food, is really crucial to help differentiate those temporary stress-induced highs from the persistent pathological causes. It gives a much clearer, more stable picture.
Okay, a fasted sample is key. What about really nailing down if it's insulin dysregulation?
Right. For definitively diagnosing ID, the gold standard really involves dynamic tests. These look at how the horse's body responds over time.
Okay, like what?
Well, the oral glucose tolerance test, OGTT, or maybe an in-feed glucose test. These involve giving the horse a specific amount of glucose, either as an oral solution or sometimes mixed in a small amount of low NSC feed.
And then you test the blood.
Yes. Then you measure both blood glucose and insulin levels at timed intervals, say at 0, 30, 60, 90, 120, 180 minutes.
What are you looking for?
What you're looking for is not just hyperglycemia, but also an exaggerated, prolonged hyperinsulinemia, that high insulin response we talked about. That combination strongly indicates insulin resistance.
Oh, I see.
Another robust test, though maybe less common in the field, is the Combined Glucose Insulin Tolerance Test, CGITT, which involves the simultaneous IV infusion of both glucose and insulin to directly measure sensitivity.
That makes sense. But, for an owner listening, it's easy to get lost in all these tests and numbers. What's maybe one common pitfall or misconception when people try to interpret those glucose readings? And how do these more involved dynamic tests help cut through that confusion?
That's a really crucial question. A very common pitfall is overreacting to a single high glucose reading, especially if it was taken during a known stressful event, like a colic episode or transport.
Right, the context matters.
Immensely. An informed owner needs to understand that one number, out of context, doesn't tell the whole story. These dynamic tests provide that essential context. They show us how the horse's body, specifically its insulin response, handles a glucose challenge over several hours.
So it's not just a snapshot.
Exactly. It allows us to really see if the insulin response is adequate or if those rusty locks of insulin resistance are truly at play. They provide the precision needed to differentiate a temporary spike from a genuine chronic metabolic issue like EMS.
Okay, that clarifies things a lot. And for diagnosing PPID, what's the go-to test?
For PPID, measuring resting ACTH is the most common initial diagnostic test. An elevated ACTH level indicates PPID, which, as we've discussed, frequently causes insulin resistance and subsequent hyperglycemia. And of course, your vet will likely run routine blood work too, a CBC, a biochemistry panel. These help assess for any underlying systemic illness, check electrolyte balances, and evaluate kidney or liver function. A urinalysis can also be useful. It can confirm glucosuria glucose in the urine if the blood glucose is high enough to have exceeded that renal threshold we talked about. #3. Navigating treatment and long-term management.
All right, now on to the big question everyone wants to know. Treatment. And I think it's absolutely critical we emphasize up front that treatment is highly dependent on the underlying cause and the severity.
Cannot stress that enough. There's absolutely no one-size-fits-all solution here.
So let's break it down. What about acute severe hyperglycemia, like in really sick foals or critically ill adult horses?
Okay, in those urgent situations, the first and most important step, without question, is to address the underlying illness. You have to treat the primary cause, whether that's aggressive antibiotics and fluids for sepsis, or maybe surgery and supportive care for severe colic. The hyperglycemia itself is often a secondary symptom of that deeper, critical problem.
Right. Treat the fire, not just the smoke.
Exactly. Now, if the hyperglycemia itself is severe enough that it needs direct intervention in addition to treating the primary cause,
Yes.
then short-acting regular crystalline insulin, usually human recombinant insulin, can be administered intravenously. This is typically given as an initial bolus, like a starting dose, followed by a continuous rate infusion, or CRI, for more consistent control.
Okay.
But, and this is but here's the crucial caution, this treatment demands extremely careful and frequent glucose monitoring. We're talking hourly, at least initially.
Why so frequent?
To prevent dangerous hypoglycemia crashing the blood sugar too low, which can be life-threatening. Because of this risk, it's generally avoided in conscious horses that aren't receiving a constant glucose infusion alongside the insulin. The risk of overshoot is just too high.
Gotcha. So it's really an intensive care scenario.
Absolutely. And IV fluids are also essential in these cases to correct dehydration and support overall circulation.
Okay. Now let's shift gears to the more common scenario. Chronic hyperglycemia, like what you see with EMS or PPID.
Right. And for these conditions, lifestyle modifications are the absolute cornerstone of treatment. I mean, truly fundamental. These aren't just suggestions. They are the core therapy.
And at the very, very core of that is dietary management.
Number one, without a doubt, we're talking about implementing a strictly low, non-structural carbohydrate NSC diet.
So what does that mean in practical terms?
It means completely avoiding grains, sweet feeds, anything with molasses, and especially lush, high-sugar pasture. The focus absolutely has to shift to a high-quality, forage-based diet.
Just hay.
Primarily good quality grass hay.
Yeah.
Ideally, you'd get your hay tested to ensure it's less than 10–12% NSC on a dry matter basis.
That testing seems important.
It really is for precise management. But a practical tip many owners use is soaking the hay. Soaking it in water for about 30 to 60 minutes can significantly reduce the NSC content further.
Okay, that's helpful. What about pasture?
It's vital to minimize pasture access, particularly that lush, rapidly growing spring or fall pasture, which can be incredibly high in sugars. Utilizing dry lots or well-fitted grazing muzzles is often necessary to control that intake.
So they still get turnout, but not the rich grass.
Exactly. And you'll want to use specific low NSC commercial feeds or ration balancers. These are designed to provide the necessary vitamins, minerals, and protein your horse needs without adding all those extra sugars and starches found in traditional feeds.
What if the horse needs more calories, though, like for weight gain or performance?
Good question. For adding cool calories energy without the sugar rush fat supplementation is an excellent option. Things like rice bran oil, flaxseed oil, or specific high-fat, low NSC feeds can work well if weight gain is desired without messing up the NSC balance.
Okay, diet is huge. What's next?
Equally key is a gradual, regular exercise program. This isn't just about burning calories. Exercise directly improves insulin sensitivity in the muscles.
So it helps the body use glucose better.
Precisely. And, of course, it's vital for achieving and maintaining a healthy weight. The goal should be daily, consistent turnout, and some form of work, obviously tailored to your horse's soundness and abilities. Consistency is really important.
Diet and exercise the foundation. Are there medications involved too?
Yes, and these are often powerful adjuncts, meaning additions to those essential lifestyle changes. They don't replace diet and exercise, but they can be very helpful.
Okay.
For horses diagnosed specifically with PPID, pergolide mesylate is the primary licensed medication. It's a dopamine receptor agonist. Basically, it works on the pituitary gland to suppress that excessive hormone production.
Including the cortisol.
Including the cortisol. And by doing that, it improves insulin sensitivity and helps normalize blood glucose levels. It's the standard of care for PPID.
What about other medications? I've heard people mention thyroid hormones.
Yes, thyroid hormones, specifically levothyroxine sodium, are sometimes used, but it's important to understand how. It's not a primary treatment for hyperglycemia itself, but it can be used sometimes off-label to help promote weight loss and improve insulin sensitivity in horses that are obese and insulin dysregulated, even if their baseline thyroid function tests as normal or euthyroid. It's more of a tool to help kickstart weight loss in difficult cases.
Gotcha. Any newer options on the horizon?
Yes, and this is a really exciting area, SGLT2 inhibitors, drugs like canagliflozin or ertugliflozin.
How do they work? It sounds complicated.
Their mechanism is actually fascinating. They work in the kidneys, and they block the reabsorption of glucose back into the bloodstream from the renal tubules.
So the glucose stays in the urine.
Exactly. It leads to glucosuria, glucose being excreted in the urine, which then directly reduces the glucose levels in the blood.
Wow. Are these widely used yet?
They are currently still under investigation, specifically for EMS horses in many places. They're often used off-label, and availability can be limited. However, they show significant promise, especially for those really tough cases of hyperglycemia that aren't responding well enough to diet, exercise, and maybe pergolide if PPID is also present.
Are there downsides?
There can be. Because they make the horse urinate out glucose, they can cause increased urination and thirst, naturally. And there's potential for electrolyte imbalances or urinary tract issues, so careful veterinary monitoring is absolutely essential if these drugs are used.
Okay. What about things like metformin or supplements like chromium and magnesium? People talk about those sometimes.
Yeah, those have been explored. Metformin, which is common in human diabetes, unfortunately seems to have quite poor bioavailability in horses when given orally, meaning not much gets absorbed. So its effectiveness is questionable. Chromium and magnesium supplements are often marketed for metabolic horses. And while they play roles in glucose metabolism, strong scientific evidence showing significant consistent benefit in treating equine hyperglycemia or insulin resistance is often lacking or variable. They likely don't hurt, but shouldn't replace the core strategies.
Right. Focus on the proven foundations first.
Absolutely.
Yeah.
And finally, a critical part of overall management is aggressively addressing other complications. If laminitis is present, especially when hyperglycemia is linked to EMS or PPID, managing that effectively is paramount. And as we keep saying, getting that excess weight off is absolutely fundamental for improving insulin sensitivity in obese horses. It all ties together.
It really does.
And, if we connect all this back to the bigger picture, it becomes abundantly clear that by treating the underlying condition, the EMS, the PPID, the sepsis, the hyperglycemia, often resolves or at least improves dramatically on its own.
Right.
Which really highlights why consistent owner education and follow-through on these management plans, the diet, the exercise, the medications if needed, is absolutely vital for long-term success. It truly is a team effort with you, the owner, right at the center of that team.
Okay, so we've explored the causes, the diagnosis, the treatments. What does the future generally hold for a horse that's experienced hyperglycemia? Let's talk about the prognosis.
Sure. Well, it really varies depending on the cause, as you'd expect. For that simple physiological hyperglycemia, the temporary stress or post-meal spike, the prognosis is excellent. It resolves completely once the stressor is gone or the meal is digested. No long-term issue.
Okay, good. What about the more serious cases, like SIRS or sepsis?
For hyperglycemia secondary to SIRS or sepsis, the prognosis really depends heavily on the severity of the underlying illness itself. As we mentioned earlier, persistent or very severe hyperglycemia in those cases, say glucose levels consistently over 250 or 300 milli-GDL in a horse with colic, can unfortunately be a negative prognostic indicator. It suggests the horse is under extreme metabolic stress and might have a poorer outcome.
Okay. What about the chronic conditions, EMS and PPID?
For hyperglycemia secondary to EMS, the prognosis for actually managing the condition and improving blood glucose control is generally good, if there's strict adherence to those diet and exercise protocols we discussed.
But it's lifelong, right?
It absolutely requires lifelong commitment and management. There's no quick cure. The same really goes for PPID. Generally, a good prognosis for controlling the signs, including hyperglycemia, with daily pergolide medication, often combined with the same dietary and exercise management needed for EMS, especially if they coexist. But again, it requires lifelong medication and vigilance.
And what about that very rare pancreatic diabetes?
Unfortunately, for true pancreatic diabetes, like the type 1 equivalent, the prognosis is grave. It's typically considered fatal in horses due to the extreme difficulty and impracticality of managing it long-term with insulin therapy outside of a specialized setting.
Right. Okay, so management is key for the common chronic causes. Looking ahead then, let's talk about prevention. Can we stop this from happening in the first place?
That's the ideal scenario, isn't it?
Yeah.
And yes, there are definitely proactive steps owners can take.
And this next point, I think, truly highlights the power we have as owners in managing our horse's health through these proactive measures. It's not just about reacting to problems.
Exactly. For those breeds known to be at risk for EMS, feeding an appropriate diet right from the start is paramount. That means limiting NSC intake, so avoiding routine grain feeding, being very careful with lush pasture access, and promoting a primarily forage-based diet throughout their lives. Weight management is also absolutely crucial. Preventing obesity through careful dietary planning and consistent exercise is honestly one of the single best preventative steps you can take against EMS and the associated hyperglycemia.
And the exercise itself?
Speaking of exercise, maintaining regular, consistent activity helps optimize insulin sensitivity even in horses that aren't overweight. So, regular turnout and work are beneficial for metabolic health across the board.
Makes sense.
Early detection of EMF and PPID is also key. Vets are increasingly recommending screening for at-risk horses.
Who would be considered at risk?
Horses that are obese, those developing that cresty neck, or any horse with a history of laminitis, even mild episodes. Screening them periodically for insulin dysregulation and, especially in older horses, for PPID can catch problems earlier.
Before they become severe.
Exactly. And finally, just being mindful of the judicious use of corticosteroids.
Yeah.
Avoiding unnecessary administration of these drugs, especially long-term or high dose, is important given their known impact on insulin sensitivity and blood sugar.
Right. This whole deep dive has really shown us, hasn't it, that hyperglycemia in horses isn't really a standalone disease itself.
No, it's a sign.
It's a critical sign, yeah. A sign of various underlying conditions, ranging from completely normal physiological responses all the way to very serious metabolic and systemic illnesses. It's definitely a complex puzzle where every piece really matters.
That's spot on. And understanding the cause-specific nature of hyperglycemia is absolutely key to getting the diagnosis right and implementing effective treatment. It also really reinforces the profound impact of those lifestyle changes, especially diet and exercise, for the chronic conditions like EMS and PPID.
They're not just add-ons, are they?
No, they're absolutely central to long-term health and management. Foundational.
I think the real aha moment here, for me anyway, is realizing how closely related these seemingly disparate symptoms can be. Things like obesity or recurrent laminitis, or even just a strange long hair coat. How they all can connect back to the horse's underlying glucose metabolism. It all ties back to those blood sugar levels, telling a really important story about your horse's inner workings.
It really does.
So here's a final thought to leave you with. Given the, well, seemingly increasing prevalence of conditions like EMS and PPID and the really clear impact that diet and exercise have, how might a deeper understanding of equine glucose metabolism fundamentally shift our approach to preventative care and nutrition for all horses, not just those already showing overt symptoms?
That's a great question to ponder. We definitely encourage you, the listener, to observe your own horses for the signs we've discussed today. Look at them with maybe slightly different eyes now. And if concerns do arise, please consult with your veterinarian for proper diagnostics and guidance. Keep exploring this fascinating world of equine health because, honestly, the more you know, the better equipped you are to ensure your horse truly thrives.